We're now ready to introduce to you side positions. The first one will be applied side peak positioning. These are wonderful alternatives to your normal everyday prone and supine. These are relatively simple once you have the positioning in place. So for our first variations, we're going to use ordinary bed pillows. The actual pillows that we use do have a special covering that can be cleaned, but the sides is exactly like a bed pillow that you probably already have. Now, you'll need to vary the number of pillows that you use depending on client size and things like that. We also have a couple of bolsters for the neck, and what we're looking for is again, neutral, straight spine. So we want to use a thickness of our neck bolsters to achieve that. And we want to make note of observations we've made before about the feet, and perhaps we'll place a bolster underneath the foot to support also. And once you have that, that is basically it for this side position. I want you to make a note that the body in this position is completely supported on the bony structure. There's no pressure on the soft tissue. There is the added dimension, and we're going to show you a variation of this next, that we are lying directly on the shoulder, and in this case on Sam's right shoulder. And this can sometimes cause a little bit of discomfort in certain cases. Side position may be uncomfortable in the shoulder region for certain clients who might have bursitis or another condition. In this case, we recommend using the Nirvana table with the insert removed to allow more room for the shoulder. Giving more space for the shoulder will help align the shoulders and upper spine. Okay, once positioned, we go into our routine. We can a little bit of traction on the shoulder, opposite on the occipital ridge. In this variation, we're going to use the Nirvana mate and wedges. The Nirvana mate cutout allows excellent access for the shoulder, allowing proper alignment for the back. We'll begin at the shoulder. Little rotation and opening with the occipital region again. Checking behind the shoulder blade. Make sure the arm is placed well. We've got Sam's funny bone here and his radius and ulnar. Maybe some of you know the anatomy better than I. I'm not sure if he has his arm twisted. Sorry about that, Sam, if your arm bones are not in the proper place. Pressure down the back. Make sure the pelvis is positioned and seated properly. Adjust the leg if necessary. Coming down, again, excellent access, the inside of the leg, slight pull. And again, check your positioning on the foot. And you're ready to begin your normal treatment protocol. Variation using the Nirvana mate. We talked about discomfort that can be caused lying directly on your shoulder. The mate with the cutout alleviates some of that. I've taken the pillow out just to illustrate that. I'm going to put it back in now to show you. Okay, Sam, we'll have you relax your arm. You may also use the Nirvana mate with the insert removed. This will give more space for the shoulder, allow the shoulders and upper spine to maintain perfect alignment. The gentle slope in the lower portion of the mate allows the hips and lower spine to remain in a more neutral position as well. Use 1 to 2 pillows under the upper leg as needed. Continuing on in our exploration of side position, we're now ready to begin 3/4 prone peak positioning. This is, again, in my opinion, a wonderful position that may be new to some of you. The difference between traditional side position, 3/4 prone, is we have the shoulder back and the arm behind our client. This is a very natural position. It's a very relaxing position, and I encourage you, even though you may not use it traditionally, to give it a try. To position Sam, we're again using our bed pillows, and variation on the number and the thickness will depend on your client and the exact positioning that we need to achieve. We're again looking for a neutral position. We're keeping the spine in neutral, straight position. 3/4 prone positions perfectly for our purposes in peak positioning. We're on the bony structure again. No pressure on the soft tissues. And once we're ready with our positioning, we begin the treatment protocol, checking the shoulders for relaxation. We just want to make sure that the shoulder and arm are placed comfortably on our pillow. Gentle traction in the arm. Position and pull the lower shoulder down. Pressure on the back, gauging any areas of tension or tightness. Make sure the pelvis is seated correctly. You can apply a little bit of compression down the back, traction on the iliac crest again, like we did in side position. Come down and stretch the inside leg. Excellent access to the inside of the leg. Gentle traction here. Support the foot if necessary. Check that the foot is properly positioned. And again, like in side position, good access to the iliotibial band. And we've completed our peak position protocol. You're ready to begin your normal protocol.